The big news is the enrollment period for the Affordable Care Act starts November 1st and it goes through December 15th. So it's important that people look and see what their options are. There's a lot of options for health insurance, quality health insurance that can get people covered out there. There's subsidies for folks that are at certain levels of poverty in the community as well. So it's just important that you check it out. We've reduced our uninsured from 18% to about 6%. Our city is getting a lot healthier as a result of this. So we're hoping that everybody will get their health insurance. So we encourage everybody, obviously, to have health insurance. We're here today to strongly encourage people to continue to enroll here in our city, in our state, starting this Wednesday, November the 1st. And a reminder, the enrollment period is much shorter than it has been in years past. It ends on Friday, December 15th, so this is just a 6-week enrollment period. So don't wait until the last minute. If you can start this week, please get started and get enrolled. And if you need help, it's available. Buying health insurance in any aspect can be confusing, so having help is always appreciated. Trained and certified assistors are available. It's free, it's confidential, it's unbiased. They can walk you through the enrollment process and answer your questions. And even if you already have health insurance, they can help you compare what's available to what it is that you're thinking about. Local assistors are available through family health centers, KIPDA, Park DuValle Community Health Center, and the Shawnee Christian Healthcare. We've got a lot of our assistors here with us today. If y'all would raise your hands so we can thank you guys very much for the wonderful work that you all are doing. Appreciate y'all. And it must feel good to help people stay healthy. Now, remember, coverage under the Affordable Care Act is quality insurance. It covers hospital stays, doctor visits, preventive screenings, and well child visits. It also covers mental health and substance abuse treatment. In the midst of the opioid crisis is taking in this part of the country, that type of treatment has never been more important. So please, make sure that you have insurance so you have access to treatment if you need it. One other point that I don't want to get lost in all of this discussion, sometimes people talk about health insurance as if it's some type of abstract issue. What we have been so delighted to experience with the increase or with the Affordable Care Act is that people are getting healthier in our city, in our state. Our rate of uninsurance has dropped from 18% in 2013 to 5.8% in 2016. That's a big deal in terms of giving people peace of mind. More people are getting health screenings for things like breast cancer and high blood pressure, and death rates for cancer, heart disease, and diabetes are going down. It just makes common sense to have availability to health care for all Americans so you can do preventive work so you don't have to pay more later and also have less suffering. So that's a big reason for, it's a big part of the reason for why we're here today. We want to make sure that you can get the benefits that are available to you so you and your family can appreciate and experience a healthier life. Now I would like to invite one of the country's great champions for the Affordable Care Act. He is the best congressman in America, and we're fortunate to have him represent us here in the great city of Louisville. Please welcome John Yarmouth.
Thank you, Mr. Mayor. This is a very, very important event, and it's a very, very important time period for healthcare in this country. Greg didn't want to say it. He was being very nice to the administration. I'm not going to be so nice. The administration has done, this is the Trump administration, by the way, in case you were wondering. The Trump administration has done virtually everything they could to sabotage the Affordable Care Act. When Greg mentioned that the enrollment period has been cut in half, that was because the Trump administration decided they didn't want to get let people have as much time as they've had in the past to do it. So they cut it by half. The administration cut the advertising budget for the enrollment period by 90%, so you won't see a lot of advertising suggesting you get out and get insured. They have cut hours on Sunday for the website by a number of hours every Sunday, again, making it harder for American people to access the resources they need to make sure they have insurance. All that being said, as the mayor said, and it's very important, nothing has changed about the system. If you make up to 138% of poverty level, you still qualify for expanded Medicaid. So keep that in mind. If you are shopping on for individual insurance in the exchanges and healthcare.gov, 80% of you will be eligible for a government subsidy. So even though many of the premiums have increased this year, to a certain extent because of these efforts to sabotage the law, the end product, the end cost to most citizens will not increase because the subsidies are set up to match any increases in premiums. So this is very, very important. Insurance is still available. Again, as the mayor said, on Wednesday, you can actually start enrolling, but you can go onto healthcare.gov right now and start shopping and previewing. If you do nothing, if you already have insurance through the exchanges, if you do nothing, you don't have to do anything. I would suggest that you go online and see if there are better plans available, shop around. But if you're happy with what you have, you don't have to do anything. You will be re-enrolled. So all of those things are important. We have all this information on our website, and I'm sure there are numerous other websites that have this information available. So you got to get at it. Again, only 6 weeks to do it, but if everybody does what they should remain insured with quality coverage at a price they can afford. So, Greg, thank you for hosting this, and it's a very, very important piece of information to get out again, because you're not going to be able to find it probably through the Trump administration. Thanks very much.
Thank you, Congressman. Now let's hear from Emily Beauregard. She's the Executive Director of Kentucky Voices for Health, who will share with us some stories from people who need and have used the marketplace and what it's meant for them in terms of quality of life, job mobility, and financial stability. Emily?
Thank you so much, Mayor Fisher. What a year it's been for healthcare. In spite of all the odds, the fact that we've made it here today to celebrate Open Enrollment 5 is a huge success. As the leader of a coalition of health advocates, I can't tell you how grateful we are for the unwavering champion we have in Congressman Yarmouth. And on behalf of the Louisville Metro Board of Health's ACA Enrollment Committee, I want to thank Mayor Fisher for making access to care a priority for Louisvillians, for every Louisvillian. His leadership and commitment to health are evident in the partnerships we forged with the Louisville Metro Department for Public Health and Wellness and so many other community organizations that have helped to make expanded coverage a success. I've had the honor of working with the dedicated application assistors at family health centers, at Park DuValle Community Health Center, Shawnee Christian Healthcare Center, and at KIPDA to get Louisville covered, and we did it. Collectively, we helped tens of thousands of Louisvillians from all walks of life, incomes, languages, and with every conceivable health need to enroll in quality, affordable coverage. If you want to know the real secret to our success, it's them. So as you can imagine, being here today to kick off the 5th year of open enrollment means a lot to those of us who have been doing this work since 2013. It means that the ACA is still the law of the land. It means that Kentuckians without the option of employer-sponsored health insurance will still have a place to shop for quality, affordable coverage. And it means that Kentucky will continue to lead the nation with the greatest decline in the rate of uninsured. I never get tired of saying that. It's an achievement we're celebrating, and it's progress that Kentuckians can't afford to lose. Despite the rhetoric and political debate surrounding the ACA, the bottom line is this. Kentuckians need quality, affordable coverage just as much now as ever, and that's why we're here. In one way or another, the ACA touches us all. For some, it means peace of mind. For others who have faced bankruptcy due to medical bills, it means economic security. For the 1.8 million Kentuckians with a pre-existing condition, it means protection. For many, it means job mobility. And for every woman and all those struggling with addictions or behavioral health conditions, it means finally getting the guaranteed benefits you need. At Kentucky Voices for Health, we hear from people every day, entrepreneurs, parents, caregivers, small business owners, nonprofit sector workers who have benefited from expanded coverage. And I want to share a few of their stories with you. Chelsea is a single mom, graphic designer, who enrolled in coverage after being uninsured for 2 years. She told us that those years were scary ones because she had to travel from Louisville to Lexington for work every week and always worried that a serious accident could land her in the hospital with no coverage and a mountain of medical debt. But with subsidies, Chelsea was able to purchase a Silver CareSource plan for less than $100 a month. Coverage for families like Chelsea's has given them peace of mind and financial security, knowing that a medical problem isn't going to lead to bankruptcy. My dear friend Pam lost her job earlier this year. She was working as a therapist for one of the hospitals in town, and when the entire department was cut. She was sad to leave her colleagues and concerned about what job options she would have, but the worry that was heaviest on her mind was health care. She had been talking with her doctor about a foot surgery she needed to have, and she had a monthly prescription that was very expensive. So she was convinced that she needed employer coverage and would have to settle for whatever job she could find. But once she shopped on healthcare.gov, she found a plan that gave her the freedom to open up her own practice. And I can't leave here today without talking about Kentucky's farmers. Ben and Bree operate Rootbound Farms. You can visit them on Saturdays at the Beargrass Creek Farmers Market on Shelbyville Road. They rely on healthcare.gov to give them the freedom to be entrepreneurs. For them, it's been an essential economic tool in getting their small business off the ground. They say it's the reason that they can now both work full-time on their farm. These stories remind us of why coverage matters and what makes open enrollment so important this year. The stakes are high. As Congressman Yarmouth mentioned, President Trump's decision to stop paying for cost-sharing reductions to help low and moderate income Americans afford their coverage means that insurers had to inflate their premiums to offset those losses. The open enrollment period has been cut in half, from 12 weeks to 6 weeks. The website will be down for maintenance on Sundays, every Sunday. And the marketing budget was slashed by 90%. Understandably, there's a lot of confusion right now. People are worried that they're once again going to go uninsured. But here's the most important thing that you need to know, and you're probably going to hear it from each of us today. For about 80% of Kentuckians, healthcare.gov will provide the subsidies that you need for affordable coverage. 80% of Kentuckians will be eligible for these subsidies, and some may even find a better deal than they got last year. So my message for you today is this: please don't let the headlines discourage you from shopping. The best thing you can do is know what your options are so you can make the right decision for yourself and your family. You can preview plans now on healthcare.gov, so don't wait. If you have questions or need help enrolling in coverage, reach out to an application assistor. That's why they're there. I can't tell you how many people I've heard who have gotten sticker shock looking up pricing for these different plans, and they almost gave up, only to have an application assistor help them select a subsidized silver plan for a fraction of the full price. Now, I don't want to sugarcoat this. Some Louisvillians who make just a little too much to qualify for these subsidies are going to be faced with hard choices. The best thing I can tell you is that once you've shopped, be sure to call your legislators to share your story and let them know how important it is for you to have access to a stable, competitive marketplace with cost-sharing subsidies to make coverage affordable at every income level. But first, don't forget to shop. Please spread the word about open enrollment, and you can find all the information you need on the city's new website, which is right here at getcoveredlou.org. So now I want to invite Kelly Colley to come up from KIPDA. She has been managing their outreach and enrollment program and does a fantastic job. So she's going to talk to you about all the details.
Thank you. Good afternoon. I'm speaking this afternoon on behalf of all the Assistor agencies throughout the city and throughout the state. Assistors would like to encourage people to take advantage of the free help that is available to them. Our assistors have a significant amount of experience with nearly every situation that can occur, and they can help walk you through every step of the enrollment process. If you already have health insurance, then we can help you look at what your options are. Plans, prices, financial assistance, all changes every year. So we can work with you to find out the best plan for you and your family. And I want to caution those that are in the Louisville area, especially that if you are enrolled in Anthem for this year, that you will be auto-enrolled into a CareSource plan, which may have different providers in their network. So it is important that you seek the help of an assistor to identify if your doctors are in the network and what we can do for a plan to help you if they're not. In addition to locations of certified in-person assistors throughout the city, help is available at offices and regularly scheduled events all over. And you can find those dates and schedules at the getcoveredlou.org website. KIPDA assistors are also sponsoring 3 health fair enrollment events in the Louisville area. November 15th at the Sun Valley Community Center, November 30th at the South Central Regional Library, and December 6th at St. Matthew's Community Center. We will be offering free digital Santa photos at these locations, in addition to enrollment opportunities and several health screening options being provided by Shawnee Christian Healthcare Centers. Additional health and enrollment fairs are being held throughout our 16-county region. Please join us at one of these events or locate your nearest certified assistor at www.getcoveredlou.org. When you meet with an assistor, bring your photo ID, your social security number for every member of your household, income or tax filing information, and any immigration documents that might be necessary if that applies. This will make the process as smooth and quick as possible, and avoid the tax penalty and complete your enrollment between November 1st and December 15th with the help of a certified public in-person assistor. Mayor Fisher?
Thanks, Kelly. Emily, thank you as well. So, just a kind of personal comment. I just really regret that healthcare has become a political issue here in the United States here over the past couple years. I mean, I think it's just so important that we embrace that everybody should have access to health care. There's been tremendous progress made in this area, especially for folks with pre-existing conditions. The United States of America is the richest country on the face of the earth. And for us not to be able to figure out how to give quality health care available to all of our citizens, I think, is a real disservice to our citizens. And when we look at other countries, we know that they are providing health care to each and every one of their citizens for sometimes half the cost that we spend as a country, and their people live longer and have a higher quality of life. So this is something that we can figure out. So if you run into an elected official that says we can't afford to do this, you say we can't afford not to do this. And where we need elected officials' focus is on taking a look at that 18% of GDP that we spend on healthcare as a country and figuring out how we can use that so we have coverage for everybody and reduce cost at the same time. This has been happening in dozen-plus countries around the world have figured this out right now. So please let your elected official hear from you about the importance of healthcare. And when they talk about us not being able to do that, that's just not right. We just have not figured out how to do it yet. We can do this as a country. We can do this in our states and our cities as well. So let's get rid of the politics. Let's focus on our citizens and get health care so it's available to everybody in a cost-efficient way here in the United States of America. So in closing, let me say again, if you don't have health insurance, get it before December 15th. Please, everybody, get the message out to your friends and family that, as you've heard up here, it's a shorter enrollment period than what we've had in the past. So if we start Wednesday and then go to December 15th. And then once again, you can find all of the local resources at www.getcoveredlou.org. Use your social media then to blast that out so your network understands how they can get signed up for the Affordable Care Act. All right? And now we'll take any questions if there are any on this issue.
Just if we're going to talk about this, we'll talk about it. The concern that the enrollment period is now cut in half and what the impact is.
Well, I'll just say briefly then, John, but mayors across the country are informing their constituents about the shortened enrollment period, the 90% reduction in the publicity or advertising about the Affordable Care Act. So we need to have a grassroots movement to make sure people know they have this available to them for Americans. So you're seeing mayors have been involved with this since the very beginning, but we're redoubling our efforts here this year. John?
Yeah, I mean, it's a combination of things, but obviously all of the media coverage of efforts to repeal the Affordable Care Act have created the impression that it's not out there. I mean, there's some people actually out in the country who think that effort succeeded. The reduction in enrollment period, the lack of promotion, and the cutback in hours, all are things that are going to have an effect. And actually in Kentucky, I think 3 years ago we had about 105,000 people buy insurance through the exchanges. Last year that was down to 81,000. So the efforts to sabotage it have already had an impact. And that's a shame because there are people who could have affordable health care coverage who, for one reason or another, because of government efforts, again, to sabotage the law, do not. So that's why this event's really, really important.
And the other practical reason, Lawrence, is just people are healthier under the Affordable Care Act. I mean, what about that concept? So obviously, as elected officials, we want people to be healthier and have higher quality of life, and health insurance is a big part of that.
My understanding is the cutoff for the subsidy is about $35,000 or so. Is that about right? If you below that, you can get the subsidy, but above that, you're going to probably find a significant increase in your premium. Talk about the impact there.
Well, it's actually higher than that. For family 4, it's up in the 40s, I think.
It's about 48,000 for
Yeah.
400% of the federal poverty level.
Here, why don't you come up here,
Yeah.
because you're tied in. Kelly, come on, because you're tied into the audio on the TV when you speak from this.
Sure. The cutoff for subsidy is at 400% of the federal poverty level. So it depends on the size of your household, whether there's one individual or whether it's a family of 3, 4, or 5. It could potentially go up to $96,000 for subsidies, depending on the size of your household. So it's a fairly high level. The best way to find out is to either use the calculator that's available on healthcare.gov or to use an assistor and take advantage of our services, because that's what we do.
And last question from me, I don't mean to dominate this, but the impact of in Jefferson County now having one provider, with Anthem dropping out, there's one provider across the state. Is that going to affect premiums? Go ahead, Kelly.
Yeah, well,
We just received a copy of the premiums and what that looks like with the subsidies applied on Friday, actually, just before a meeting that I was involved in. And what we're seeing is almost no impact for those who receive any sort of subsidy. There's almost zero impact to the premium that will come out of their pocket. As far as the coverage that's available, you either will have the choice of Anthem in your county or you will have the choice of CareSource in your county. You do not have the choice of both. So there will be some adjustment, again, with provider networks and that type of thing. That's the most important thing we have to look at. But just understanding what benefits you can receive when you look at those plans. Even with CareSource, there's still 13 possible options in the Louisville area for a plan choice that you choose for you and your family. So there's still a lot of things for us to look at that make it a good fit for your family and your circumstances.
What about above the subsidy level?
The plans are still available. What we're seeing is an increase. Mostly the high increases were in the C plan areas, which is the silver plan, which is typically an 80-20 sort of plan that we look at. Those receive the highest increase in costs as far as premium because of the CSR reduction at the national level to the insurers.
I guess the bottom line is check the website, see what you're eligible for.
Absolutely.
And you can quote Lawrence on that if you did. Everybody, let's have the cameras go to him right now. Bottom line is check the website. Lots of options available. We all can agree on better health. Thanks for coming.
This has been a Metro TV production, a public service of Louisville Metro government.